Thank you so much, Lal. I've
Look,
completely run out of time. Otherwise, it was such an interesting conversation. But I'm going to have this conversation with you yet again. Let's move on. And our next story is coming from Tamil Nadu. What a shameful neglect this is. A man in Coimbatore drags sick father as the hospital denies him wheelchair. There are a lot of explanations to it, but still, it's a shame, and I'm going to tell you how. All right, that's our next story. Shameful neglect. No wheelchair for a patient in Tamil Nadu. This is in Coimbatore Government Hospital. A viral video from Coimbatore Government Medical College shows a son dragging his ailing father to a multi-speciality block, sparking widespread outrage. The elderly patient, suffering from foot ulcer and also has some pancreatic ailments, was reportedly denied a wheelchair and had to be moved, actually dragged by his son. Look at that visual. Is that a medical doctor who's looking at it, not the man in the check shirt? Oh yeah, there it is. Following the video, the hospital authorities have suspended 2 contractual supervisors. Now, reports suggest that the staff allegedly demanded money for providing a wheelchair, prompting the son's desperate action. However, Tamil Nadu Health Minister Subramanian clarified it. He dismissed there was nothing like a bribe, and wheelchairs are available at one of the biggest hospitals in Coimbatore. And he said it's a 4,000 patients come there daily, and the son acted maybe out of concern and lifted his father before the staff could assist. Now the thing is that, the other point is that the head of the Coimbatore hospital, she, and I'm not going to name her because why should I, you're a doctor, she said this is all staged. Apparently one auto rickshaw driver came and he was the one who took this video. She said that they asked for a wheelchair. We said, you please wait for half an hour, we'll give you a wheelchair. But then by then, I want to ask you, if my father was like that, I will not even wait for 5 minutes. And also, because it is one of the largest hospitals, why can't I be given a wheelchair? That's where I find the entire story very, very unfair. Professor Dr. Anita Ramesh, Professor, Savita Medical College and Hospital from Chennai is here. Thank you, Dr. Ramesh, for joining us on this broadcast. At both levels, Dr. Ramesh, it is unfair. The head of this hospital, Government Medical College, Coimbatore, she says, oh, he asked for it, no bribe or anything. We said, wait for half an hour. Like this, when I have a foot ulcer, when I have pancreatic ailments, and I'm 84-year-old, if my father was in state, I would also pick him up and walk. If you are so efficient, if you are the largest hospital, 30 minutes for a wheelchair, Dr. Ramesh, what about emergency cases? If I'm a trauma, I've had accident trauma, you'll take half an hour to give me a stretcher? Dr. Ramesh?
Yes.
Yeah.
Yes. A very good evening. Sudha, nice to be connected once again. These are again acute medical problem. The video does not speak well of any one of us, being dragged out. And I think this must be a common picture for many of the government hospitals across the country, may not be restricted to India. Yes, there is shortage of staff and this type of thing should not happen. Yes, if it is an emergency, if he had come to the emergency, that's a different scenario because emergencies work with a different thing. But he had come to the general OPs and general outpatients and there may be some delay. I understand. We always tell patients, if you're not in an emergency, we tell them to wait. But if you are in an emergency, there is another separate door of entry where the not wheelchair, they'll be taken in trolleys, immediately transported to the emergency bed. So what I understand from here, this was not in an emergency and he was waiting for the wheelchair. Yes, there is a delay of 15-20 minutes because shortage of manpower, shortage of wheelchair staffs are already there in a government hospital. Yes, but then, the way it was taken has to be apologized. But again, we have to work together with the patient and with everybody to see that the functions smoothly. So I think, yes, you cannot blame the hospital authorities completely saying that they were negligent, there is a delay. And also on the family side, yes, I understand the medical need, but then both things has to be balanced together. And this is not an emergency. He came to the OP services. OP services does have a delay because large volume of patients, what you said, 4,000, and there is, as you know already, MCI has told shortage of staff earlier in most of the government hospitals in Tamil Nadu. I'm sure it's all over India.
Ramesh, I understand there is a shortage, AIMS we go to in Delhi, same problem. But the point of the matter is, I know you will not get into politics, Dr. Ramesh, but Ma Subramanian saying, no, no, nothing like that happened. It's all
No,
been,
no. And we have to apologize. I myself and the doctor, I apologize seeing this
thank
video.
you,
We
Dr.
can't see
Ramesh. Thank you.
this, we can't
That's
let it
very
happen.
gracious. That's very gracious. You're an oncologist. I know that you also come across a lot of cases where there is desperation, there is trauma, whether I'm going to live or not, whether my beloved or loved one is going. So thank you very much for being so gracious about it. Then the head of the hospital says, half an hour is not a, I'm sorry. When he's got a foot ulcer, you're a doc, right? He's got a foot ulcer, he's 84 years old. You have to also maybe talk to the patient nicely and say, sir, we understand that your father is in trauma, but you'll have to take him down 3 floors. It's better you wait. Sir, just wait 5 minutes. Instead of saying half an hour you wait, we will give you, and then there is also allegation of bribing. Hospital, I've been to government hospitals. We do give bakshish to them, money to them. It's okay, poor things. But the point is, in a lot of hospitals, that has become a norm, Dr. Ramesh. Even for visiting hours. If I pay 100 rupees, I'll be allowed. So
Yes, this is strongly condemned. Okay, bribe is not allowed because everybody gets paid for the services and that is their services. This has to stop. We should not ask money for all this because we're getting paid for it. Their service is only to give wheelchair. I strongly condemn. Yes, it should not be asked, or whether if it had been asked or not, it is very, very wrong. This thing, and you are right. The communication, the social workers, the front desk workers also needs to be trained how to speak to people. After all, they are patient. We have to be sympathetic. Few nice soothing words will just help them to sit down. Sir, you just wait, have a cup of coffee, I'll get everything for you. That system is not in place. I think we need to get more people involved for this worker. And it seems that he's going out of the hospital. It's not he's coming to the hospital. The picture shows that his auto was waiting and he's boarding it to go home. Looks like that. So he has finished his consultation. So that's all, a little bit of friendly patient doctor, patient staff, patient management friendship is needed, and that's where the role of admins of the hospital, front desk people to alleviate this situation. Yes, I completely agree with you. This should be properly in place.
Think that more, I do not blame the politicians because it is there, they say these things. But the head of a government hospital to say such a thing, I think what she has done, or he, I mean, I don't want to name her, what she has succeeded in doing is basically turn me, because I may have wanted to go to this hospital in Coimbatore, but after seeing this, I will say, no, no, it's better, I'll go somewhere else. Because this is the way you turn away patients, whereas government hospitals across our country are one of the best, Anita. Don't you agree?
Yes, yes, you should. We have to correct ourselves first. Yes, this incident has happened and we have to apologize for it and get subsequently this should not be repeated. That should be our attitude. After all, it's a medical profession where we are not going to, we have to be the patient sympathetic attitude has to develop. Yes, I do agree with you. Yes, and also management needs to wind up with more about speed up with the more facilities, wheelchairs, recruit people to see that this type of things do not take place in future.